Hello, I'm Dr. Rhonda Johnson. Today is Friday, August 2nd, 2024. First, a trigger warning. Today, I'm talking about miscarriage. So for those who may find this topic too sensitive, please keep scrolling. Now, miscarriage or natural pregnancy loss affects roughly 10 to 20% of known pregnancies. Now, I'm not an obstetrician. I'm speaking today of my experience, personal experience, and knowledge of what is occurring in the post-Dobbs world, where we have 14 states with strict abortion laws. Now, in general, the standard treatment of miscarriage aims to make sure there are no retained pregnancy tissues in the uterus. This is necessary to prevent infection and other complications. Now, miscarriage care is similar to the medical care for abortion, and this has created issues for both doctors and patients in those states with restrictive abortion bans. Now, for my own experience, years ago when I was in my childbearing years, I had 2 miscarriages. Each time I called my doctors and I did just what they advised. With both miscarriages, they performed the post-miscarriage surgical procedure within 24 hours. But that was pre-Dobbs. I never had to face medical uncertainty. My doctors were free to manage my care without restrictions and threats of criminal prosecution and loss of their medical license. But sadly, this is not the case for many women who have a miscarriage today, especially in those states with restrictive abortion laws. Now, the Kaiser Family Foundation published an important article on May 2nd of this year. I'll include the link. They surveyed OBGYNs, the doctors who provide women's health care, in 2023. Their findings were that 20% of OBGYNs nationally said they have been constrained in providing care for miscarriages and pregnancy-related emergencies since the Dobbs ruling. However, in those states that ban or restrict abortion, 40% of OBGYNs said that they have been constrained in providing care for miscarriages. The article notes that the doctors feared criminal liability or loss of their medical license or financial penalties if they provided miscarriage treatment. Now, the doctors also expressed concerns how this can lead to delays in care. So let me say this. Having a miscarriage can be a terrifying experience. It was for me. The care for women who are having miscarriages is a tragic casualty today of the abortion war going on in this country. And this crisis can potentially impact a lot of women because in the United States, in the 2022 census, the population of women in the reproductive ages, that's between the ages of 15 to 44, was more than 65.5 million. That's almost 20% of the United States population. I strongly believe that women who are miscarrying should promptly receive the medical care they need, just as if they were being treated for an appendicitis or any other medical emergency or medical condition. And we don't need abortion bans interfering with miscarriage care. And I will say we don't need Project 2025 because denying access to abortion care, which is going to affect miscarriage care, is a major component of Project 2025. So I have an ask of viewers of this video is that you think about it. Think about what's happening in our country, a country with the most advanced medical care that you can find anywhere in the world. Now, reproductive rights and abortion are going to be on many state ballot initiatives in the November 2024 election. In my opinion, there's just no place for political meddling in the lives of women's health care. Please share this message, and thank you for listening. Take care.